This video is about how to get your pelvic floor to relax and how to engage the front, the middle, and the back parts of your pelvic floor. So we are not going to be talking about strength. We're not going to be talking about, endurance of the pelvic floor in this video. This is a very rudimentary video where all I want you to do is focusing on how to control and sense the different parts of your pelvic floor. So front, middle, back, and then left and possibly right. Possibly left and right as well. So definitely understanding that we have different sections going from front to back, and then the left side and the right side. Because oftentimes when I'm working with my clients and we're checking their pelvic floors, usually one side is a little bit tighter than the other, or a lot tighter than the other. And we need to make sure we can find a little bit of balance through both some breathing work, some internal work, maybe with a wand, as well as some lovely Pilates, but we're not going to be doing that today. So really quickly, we have, as women, so anyone assigned female at birth, we're going to be making sure we have a clear idea of how to engage the front section, the middle section, and the back. So holding your pee, that vaginal gentle contraction, and then in the back, right? So poops and farts in the back. I don't know what YouTube's gonna let me say. So in order to do that, and you're like, oh my gosh, Ellen, what are you even talking about? I didn't even know there was a front, a middle, and the back. I thought it was just one giant monolith of muscle. I'm here to tell you that the pelvic floor is actually super complex. There are so many layers. It's highly vascular, and we do need to have good control. So we're going to start off with a towel, a hand towel. And we're going to fold it in 2/3, right? Maybe you prefer to have yours a little bit thicker. That's perfectly fine. But the whole idea is that we're going to place the towel between our legs so that our perineum or our labia is in contact with the towel. So I would prefer you be on a firm surface versus like a really soft sofa. So if you've got a firm dining chair, that's great. If you have a therapy ball, you can also use this as well, right? So we're just sitting down, making sure there's some nice contact with the underside of the body where the perineum meets the towel, okay? So for the sake of filming, I'm just gonna stay here because it's a little bit easier to see versus that slightly underinflated ball, okay? We're going to place the towel between the legs, as I mentioned. We're going to make sure that we have enough contact, all right? And so if you haven't watched my other video talking about how to engage the lower abdomen with an inhale and an exhale, go back and watch that one because that really sort of dives deeper into the tummy. I'm going to be glossing over that in this video. But I want you to think of the lower tummy and the pelvic floor as partners. They both work together. When the lower tummy is relaxed, oftentimes the pelvic floor is also relaxed. And if the pelvic floor is tight, oftentimes the abs are tight or weak, right? So they're trying to help each other out. And if we think of a beach ball, when you are inhaling into your tummy, then we're also allowing the bottom side or the underside of the beach ball to be expanding down as well. Okay, so again, with that nice big tummy breath, when the tummy goes nice and big with the inhale, the pelvic floor is also relaxing down into the towel. So we're filling the beach ball in the front and the bottom sides with our inhale and vice versa when we exhale. So as we exhale, the beach ball shrinks from the front and the pelvic floor picks up from the bottom. Okay, so if we do that, let's see, I'm going to turn sideways so you can see me better. All right, and if you want to, you're more than welcome to fold the towel in half. So I folded it into 1/3, but then if you feel like you need a little bit more contact between the legs, you're more than welcome to do that as well. I like it in 1/3, but everyone is different. So as long as you feel like you have enough awareness from the towel, then that's great. Okay, so let's talk about that beach ball concept again. So you can't see my pelvic floor here, but we're gonna take a nice big belly breath here into sort of the front side of the body And then we're going to feel the perineum or the labia descending down into the towel. Okay. And again, exhaling to bring those things back in, bring the front side of the beach ball in, bring the pelvic floor up and lift off the towel. So again, big inhale into your tummy, big inhale down into the towel. So it wasn't 2 inhales. I should correct myself. It's the same inhale, but those things are happening simultaneously, right? So exhale, pick it up, pull it in, and then inhale, let it go, really allowing, again, that sense of relaxation along the pelvic floor if you can, okay? So once you've nailed that down, we can start to break down the different sections of the pelvic floor, starting off with the back, because that's generally the easiest. We're going to tilt the pelvis back. So we have a little bit more bias towards the back side, right? So your anus is going to be a little bit more in the forefront of your mind because you can feel it a little bit better. Okay. So we're going to, again, inhale down, really think of allowing your bum to relax. And then as you exhale, we're just sensing a little bit of a pucker. So remember, this video is not about strength. It's just about activation and control. So we're not looking for more than 15 to 20% of a contraction in the anus area or in your bum area, okay? The hard part with this one is if you're really squeezing too hard, your butt cheeks are going to start to clench, right? And we don't want that. We want your butt cheeks, your big, powerful bum muscles to be separate from your pelvic floor because they are different muscles. We don't want them turning on together. So again, I'm tilted back, nice big inhale down, belly goes out, pelvic floor comes down at the same time, and then gentle exhale, feeling a tiny pucker, 15 to 20% of a contraction of whatever you think might be 100. And again, inhale into the tummy, down into the towel, through the backside, right? Exhale, gentle pucker, like we're just stopping a fart or something like that, right? So that's the back. If you need to pause the video or rewatch this section, by all means, please do so. But now we're going to move on to the middle. So as you can imagine, we're going to be upright in the pelvis, thinking of nice upright bucket, okay? And we're really going to be focusing on our vagina coming down, okay? So inhaling down into the towel, feeling that relaxation around the labia, around the vagina. And then as you exhale, just a little pucker, just a little bit of activation. It's not a clench. It's not a Kegel, right? I've heard some stat that a certain amount of a percentage of women are doing Kegels incorrectly. And I'm not surprised because when I do go and do an internal exam, sometimes people are actually doing the inverse of what they should be. So if you have the ability to go and see a pelvic floor therapist in person, that's always best to confirm that your mechanics are working properly. And I always highly suggest that if you're feeling any sort of symptoms, okay? So again, let's go back to this middle here. So big inhale, belly goes out, pelvic floor comes down into the towel, exhale, gentle pucker. Are you able to get the middle, that vagina to activate without the anus coming on? Right? Is somebody else trying to get in there as well? If that's the case, then you just stop short, right? So if I'm approaching that 20% activation and all of a sudden the back starts to jump in, then, wind it back to maybe 15% being your goal. And then once you've got that, then you can go back to the 20%. Okay. So again, big inhale down and then exhaling. I'm going to stop at 15 because if I go to 20, I know something else is going to be engaging and I don't want that, right? We want to make sure that everything stays separate, okay? So as you can probably guess, to get the front part of the pelvic floor, the urethra, we're going to be tilting into an anterior tilt or a forward tilt. We're going to get a little bit more contact. If you need to, fold the front part of your towel back a little bit so you can get a little bit more contact through the front, or you can always just hold it up like that, right? No one's looking, it's okay. So we're going to take a nice big inhale, feeling that front part, maybe your clitoris, that whole area is relaxing into the towel. And then as you exhale, it's that gentle puckering to sort of stop your pee almost, right? and then release. So again, we're not clenching as hard as we can. It's just one little, connection with that front part. So big inhale down into the tummy, down into the front, and then exhaling 20%. Really small, make sure nobody else is trying to jump in. Okay, so once you feel like you can kind of get those things going, then you're just going to go back to your normal sitting. So maybe that's here, right? You're no longer straddled where you have all that contact, right? We're going to think of nice big inhale, and you're going to start off with the back pelvic floor. Oh, there it is. Okay, let's find it there. Or maybe you didn't find it, so try again, right? So big inhale down, big beach ball comes out through the front, down in the bottom, and then, oh, okay, there's the back. Can I find the middle? Okay, there's the middle, and then there's the front, right? Are they separate and isolated from each other? Maybe not in the beginning. It's really difficult. This is not something that people grasp on the first go around. So, be kind with yourself. If you're feeling a little bit frustrated, just back it up. If you find that sitting up just isn't working for you, you can also try these on your back. So I do have clients where they'll be on their backs with the towel between the legs as well. And this for them is easier because they can relax in a better fashion, but they can still have the contact of the towel. Okay. Once you've established all of that and you feel like you have a pretty good sense or a map of your pelvic floor, we can start to really feel any sort of tension that might be underlying if we're going about our day-to-day tasks, and maybe that tension has creeped up on you and you don't even know it because, it happens, right? And, life is stressful. And so we're going to try and attempt to create a little bit more awareness by talking about the fascial connection between the pelvic floor up into the tongue and into the jaw. So if you don't know what fascia is, it's sort of like the sausage casing in a link of sausages, is the analogy that I use, right? So each sausage is a separate muscle, but they're all connected via this sausage casing. So if there's tension down on the bottom link or the bottom sausage, it's going to be tugging up at the top. And so we have these different fascial lines. You're more than welcome to do an online search and learn more about it. I highly suggest it because it's really, I find it really fascinating. But we do have a fascial connection through the deep center of the body. It's called the deep front line. Starts off in our arches, comes up through the inner parts of the calf, inner thighs, up through the pelvic floor, through the core, the diaphragm, the lungs, the heart, the throat, and the tongue and the jaw. Okay, and some would say that there could be even, because they're all so closely connected into your skull. We're going to be doing a little bit of eye work as well. Okay, so if you're still with me, we're going to be using that connection between the pelvic floor and the jaw to sort of get a little bit more in tune. I call these our pelvic floor ninja exercises, okay? So we need to understand that if we tense our tongue, the top of the sausage link, it's going to create tension in the pelvic floor and vice versa. So if you've ever taken labor and delivery classes, you may have heard cues such as do some horse breathing where you're like really slack jawed, because if you slacken your jaw, you're going to slacken your pelvic floor. Or things like making really low sounds with your vocal cords, because if you make low sounds with your vocal cords relax in order to hit that pitch versus getting really tight to hit a high note, right? So if you're encouraging your vocal cords to make low sounds, it's going to relax there and relax down here. So if we're talking about tongue placement, if we lift the tongue up to the roof of the mouth, it's going to pick up the pelvic floor as well. So imagine your tongue imagine this is your tongue and this is the top of my palate. I'm going to glue my tongue up to the top of the roof of my mouth. And then I'm going to relax it and open my jaw and let my tongue just hang. Okay, and then up, and then relax. Okay, while you're doing that, I hope you're doing it with me, I want you to sense what your pelvic floor is doing as well. Okay, so when you glue your tongue to the top of your mouth, do you feel a little bit of something, some activity happening down in your pelvic floor, a little bit of engagement? And then let it go. Do you feel that engagement go away? Right? So this is actually another trick that a lot of athletes use as well. If you need to get some really a lot of like momentary core strength, like sprinting, you close your mouth and you're going to tighten up that pelvic floor, which tightens up your core. So my husband's cousin was an Olympic level sprinter, and she said she hit her fastest pace as soon as she started to activate her pelvic floor. So I'm not making it up, guys. It's a thing. So again, you're going to engage, lift up that tongue, and then relax. So that's the first sort of exercise you can try. And the next one is we're actually going to be looking at eyes. So if I look up, I'm going to be pulling up on my pelvic floor. And then when I look down, the pelvic floor relaxes. And again, so looking up, maybe feeling something happening, and then looking down, right? If you're saying, Ellen, I don't feel anything at all, it's quite possible you just need to practice more, or there could be some tension that's stopping you from feeling what's happening, okay? So don't give up, or if you can, as I said before, go and see a pelvic floor therapist, all right? Moving on with the eyes, you can also look left or right to feel the left and right sides of your pelvic floor activating as well. So when I look right, I might feel a little bit of pull on this left side. And when I look right, maybe I'm going to feel that right side kind of turn on a little bit more as well. So I know this is all very challenging. I know this is quite possibly very new to a lot of people, but it's a great place to sort of start to understand all the nuanced parts and sections of your pelvic floor and how to start to build an awareness and understanding, so that when it comes time to start to do your strengthening exercises, you know how to relax it. Because if you only do strengthening, but your pelvic floor is already tight, you're going to get stuck in this pattern of tension, and we don't want that. Because if there's tension in the pelvic floor, it can make you prone to things like leaking. It can make you prone to other things, for some individuals, things like a diastasis. So there are a lot of things that we don't want. So even like back pain, hip pain, all kinds of stuff. All right. So we have to have a strong map or an understanding of what's happening before we layer on strength.